How does PSA density affect your prostate cancer risk? Imagine trying to figure out if a small fire is just a little spark or something that could turn into a big blaze. That's similar to how doctors use PSA density to assess prostate cancer risk. PSA density is the ratio of the level of prostate-specific antigen in your blood to the size of your prostate gland. This helps doctors understand whether an elevated PSA is due to benign enlargement or something more serious like cancer. When a man's PSA level is high, it doesn't always mean cancer. The prostate can enlarge naturally with age, which can raise PSA levels without indicating cancer. That's where PSA density becomes useful. By dividing the PSA level by the prostate volume, doctors get a clearer picture. For example, if your PSA is for nanograms per milliliter and your prostate volume is 40 milliliters, your PSA density is 0.1 nanograms per milliliter of prostate. Research shows that a higher PSA density suggests a greater chance that the PSA elevation is caused by cancer rather than benign conditions. Typically, a PSA density above 0.15 to 0.20 nanograms per milliliter indicates a higher risk. Men with PSA density above this threshold are more likely to have clinically significant prostate cancer and may be advised to undergo a biopsy. Conversely, lower PSA density values, such as below 0.9, are associated with a very low chance of significant cancer, which can help avoid unnecessary procedures. PSA density is especially helpful when PSA levels are in the borderline range, like between 2.5 and 10 nanograms per milliliter. In these cases, PSA alone might not be enough to make a clear decision. Using PSA density alongside other factors like MRI results, digital rectal exam findings, and personal health history allows for a more personalized approach. This helps identify who truly needs further testing and who can safely avoid it. Prostate volume measurement is usually done through imaging techniques like transrectal ultrasound or magnetic resonance imaging. These tools give an accurate estimate of prostate size, which is essential for calculating PSA density. Major urological guidelines recommend using PSA density as part of a comprehensive risk assessment. This approach helps improve the detection of significant prostate cancers while reducing unnecessary biopsies and overdiagnosis. In summary, PSA density adds a valuable layer of information to prostate cancer screening. It helps differentiate between benign prostate enlargement and potential cancer, guiding decisions about biopsies and further testing. By considering both PSA levels and prostate size, doctors can better assess individual risk and tailor their recommendations. Always remember, if you have concerns about prostate health or screening options, it's best to consult with a healthcare professional who can provide advice based on your specific situation.